This presentation reviews the utility of physical distancing regarding COVID-19 transmission and is intended for use by school and childcare settings. There are three objectives for this presentation. 1. To review physical distancing and its role in reducing the transmission of COVID-19. 2. To review strategies to maintain physical distancing both indoors and outdoors in school and childcare settings. And 3. To provide approaches to take when physical distancing is not possible. Physical distancing is a key preventative measure for COVID-19. When a person is infected with COVID-19, being in close distance of the infected person increases the risk of exposure to their infectious droplets and aerosols. Maintaining distance from others is one measure that helps to reduce the risk of potential exposure to COVID-19. The term physical distancing means that staff, essential visitors, and students or children are to stay away from one another whenever possible. This is particularly important when masks need to be removed, for example during lunch or break. In general, a distance of 2 meters or 6 feet is recommended. As much distancing as possible between students and staff, and between staff members should always be promoted when age appropriate. Physical distancing is one measure in a bundle of measures used to prevent the transmission of COVID-19. No single measure should be relied on by itself. Consider physical distancing depending on the local context and the age of the students or children. The risk of transmission occurs most commonly with close, unprotected contact. This slide provides a few examples of what you can do to reinforce physical distancing with students or children when indicated. Talk to students or children about physical distancing and why it is important in a non-judgmental manner. Visual cues, for example, markings on the floor or walls to show distance between people, can be helpful. If age appropriate, plan activities that promote physical distancing. Model appropriate behavior by demonstrating consistent physical distancing from other staff members. It is important to note that strict physical distancing may not always be possible or recommended, especially for younger children. Masking is an important supplemental strategy that will reduce the risk with close interactions. What can you do to support physical distancing in classrooms? The classroom, or childcare setting grouping, is a natural cohort. Where distancing is recommended within the classroom, avoid having children move desks closer together or change the orientation of desks. These configurations should aim to allow distance between children and/or maintain cohorts or groups. While it is important to maintain physical distancing at all times between cohorts, it is recognized that it is not always feasible or recommended within a cohort. Therefore, it is important to remember physical distancing, along with other prevention measures such as hand hygiene and proper PPE use, must be used together to reduce the risk of COVID-19. What can you do to support physical distancing when moving between spaces? Stagger periods of movement and promote one-way flow of traffic. Maintain physical distance at all times between cohorts or groups. What can you do to support physical distancing during exercise or use of the gym? It is important that there be careful consideration around exercise and gym class because physical activity can be associated with increased droplet and aerosol formation. With this in mind, outdoor activities should be encouraged and large, well-ventilated spaces should be used if moderate to vigorous physical activity is permitted indoors. Attention should be given around processes and behaviors associated with exercising in gym class, with consideration of how to reduce person-to-person contact and spread of droplets and aerosols. For example, Signage should be posted informing students of the maximum occupancy to facilitate physical distancing during the use of locker rooms and showers. Students should avoid direct and close physical contact. What can you do to support physical distancing during outdoor activities? The risk of transmission is reduced outdoors, but health and safety measures should continue to be encouraged. Consider activities such as nature or scavenger hunts, hide and seek, tag, and obstacle courses that can occur outside. On the playground, important protective measures to prevent the transmission of COVID-19 include limiting the capacity and avoiding crowded playgrounds, and cleaning your hands before and after using playground equipment with alcohol-based hand rub or soap and water. Wearing a mask outdoors should follow local public health guidance and can be considered when physical distancing is not possible. This slide highlights a few points related to lunch and nutritional breaks. In order to promote physical distancing, lunch and nutritional breaks can be staggered and remain in designated areas assigned for eating food and drinking. Distancing should be promoted as much as possible at times when masks are removed. Clear instructions should be provided to students and staff on how to safely take off and store masks at lunch or other nutrition breaks, as well as putting masks back on afterwards. Hand hygiene is to be performed before and after touching their mask and eating or drinking. For staff rooms, staff should maintain at least 2 meters distance when masks are removed while eating and drinking. If you would like more information, please see the list of resources here. Public Health Ontario would appreciate your thoughts on these refresher presentations. Please visit PHO's School Resources webpage to access and complete a short survey. If you have any questions, please email communications@oahpp.ca. Thank you.